Hi, my name is Jason Salemi. I'm an associate professor of epidemiology at the University of South Florida's College of Public Health. And today I want to do something that is, in all honesty, long overdue. I think anybody who's watching this video probably started to follow me because of my COVID-19 dashboard. And over a month ago, I revised what that dashboard made available for two primary reasons. One is that the Florida Department of Health and Agency for Healthcare Administration in Florida started to modify the amount of information that they were making available. And the other thing is, I've also started to incorporate some additional data sources that I had not previously. And so I've gotten actually a lot of emails just asking general questions about where does this visualization come from? How did you get access to this information? And so I just wanted to take a few minutes to walk through the visualizations that currently exist on my dashboard and just very briefly describe what they are, what data they're from, and how you can best utilize those data sources. And so this is the primary page to my COVID-19 dashboard as it exists today. I actually just did an update a little bit earlier this afternoon. And so hopefully all of these numbers will at least be current. My goal is not really to talk about the numbers, but I'm sure in describing what the visualizations are designed to do, I'll also talk about what the numbers mean. And so, as you can see on the left-hand side, the dashboard is currently organized into the various measures that I make available. So, summary measures is basically all of the new information from the Florida Department of Health's weekly report. In that weekly report, they go over things like the number of cases, both new and cumulative. We talk about positivity rates, vaccination rates, as well as COVID-19 deaths. So this first page is really all about that weekly report and trying to take that information and make it a little bit more easy to understand, visualize, and interact with. Then we'll talk about vaccines nationally, which I get that information from the CDC's COVID-19 tracker, the number of patients who are currently hospitalized with COVID-19, as well as new hospital admissions for COVID-19 by age. Both of those I get from the Department of Health and Human Services. Then we'll talk about all-cause excess deaths, which I get from the CDC and the National Center for Health Statistics. And then last but not least, a bit on variants, which I basically just repurpose the exact visualizations that are provided by the CDC. And so again, this is the first page. For all of my pages on my dashboard, you'll see that I start out with a table of contents letting you know all of the visualizations that are going to be listed on this page. And so we'll just start out with the first visualization. You can see it says weekly COVID-19 cases and new test positivity. So this visualization is exactly that. On a week by week basis, the lighter blue bars are the total number of COVID-19 cases that were new in that week. And then the solid blue line is not what some people might think it is, which is the 7-day average number of cases. Because I'm only available to present information on a weekly basis now, the actual 7-day trends become less important. You're actually getting that by the bars. So I just decided to put two different measures on this visualization. And so the blue bar is new test positivity. And so like all of my visualizations, when you hover over a particular data element, you get a lot of information. In this case, when you hover over any of the bars for a particular week, you get the total number of cases in that week. You get the weekly rate per capita. In this case, it's per 100,000 population. And then you get some relative numbers. So if you were wondering, well, how does the number of cases that we observed this week compare to 1 week ago? Well, I can answer it with this. It's 48% higher. Well, what about relative to 2 weeks ago? It's more than doubled, 101% higher. What about compared to 4 weeks ago, 8 weeks ago? And so you can very quickly get an idea of where are we in the most recent week relative to various time points in the past. And then, of course, you get the total number of cumulative residents to date and the total number of residents in Florida that have ever tested positive. And so it's the same thing for the positivity. You'll get the positivity this week and then relative comparisons made to weeks in the past. So that's the first one, pretty straightforward, easy to understand. The next one is weekly vaccination doses and rates. And so again, pretty straightforward. What I provide to you in all of the lines there, the different colored lines, is basically each line is an age group. The black line is everybody who is a vaccine eligible age. That's why that tends to fall in the middle of all of the other lines. It's kind of an age averaged curve. And so, again, this is a quick snapshot at the trajectories, how we've been doing in the percentage of the population that has received at least one dose in each of these age groups. And obviously, vaccination rates are very correlated with age. As you increase in age, the more likely you are to have been vaccinated with at least one dose. I also present some milestone markers here. When did we expand vaccination eligibility to all people 60 years of age? When did we expand it to other age groups? So, that's the kind of information that's on here. Again, when you hover over any data point, in this case, what you get are the total doses administered to residents in the week of interest. And then you get by age group the total number of people that have had at least one dose, as well as the cumulative number of people to date in each age group that have been vaccinated with at least one dose. This gray area curve that's in the background, that is essentially giving the weekly number of doses administered. And so obviously you can see what has happened of late is we've been giving less and less doses on a weekly basis. Moving on to the third visualization, this is the age distribution of new vaccinated people each week. So basically, you're going to get two versions of the same information. This is kind of version number one. And so what this does is this is not necessarily meant to track the volume of vaccinations that we're giving. Rather, it's supposed to say, okay, of everybody who is vaccinated, whether that's a lot of people or just a few people, what is the age distribution of vaccinated people? And so, for example, early on, when vaccines first rolled out in December, it was first opened up to healthcare providers and residents of long-term care facilities. So that's why you see an age distribution that includes a lot of different age groups. And then, of course, as we got beyond the healthcare providers and we started to open things up to all of the seniors in our population, that's why seniors dominated the percentage of all people that were being vaccinated on a given week. And then, of course, as we hit these key markers of expansion to 60 plus, 50 plus, 40 plus, you can see that those age groups start to become a larger share of the number of people that are vaccinated each week. And more currently, if you just hover over any marker in the graph, you get that same kind of information. So I know for the most recent week that has been reported by the Florida Department of Health, the largest numbers of people vaccinated are actually in the youngest age group, the 12 to 19-year-old age group. And so, again, that's just the idea behind how you use this visualization. It's very similar to the next visualization. The big difference is here, not only do you get an idea of the share of total doses on a given week by age group, but you also get, the height of the graph tells you how many doses were administered. And so you get multiple pieces of information in this case. It's everything that you could observe in the previous visualization, but you also get, again, the same sense that, wow, we've been going down in terms of the number of weekly doses, over the past several weeks. And again, you can still get an idea that, this dark blue bar is the highest. And so you can see that the younger people are driving that share of vaccinations. So the next couple of visualizations are all about county level maps, and each of these maps is going to be focusing on a different metric. I've recently modified this. So often people, I had basically one map and it was showing you the most recent information for the past week. But I had so many people that were inherently wanting to compare, well, how does this compare to last week or the week before? So I've decided now to change this visualization. So now you always see the two most recent weeks that have been reported, and at least you can do a comparison now. And so this first visualization is all about vaccination rate. So these are cumulative vaccination numbers of vaccine eligible population by county. And so as you can imagine, because the vaccination rate has slowed down quite a bit, you're not going to see much of a change in the maps from week to week. So for example, if I looked at Hillsborough County, here on the week beginning 6/25, you can see that we were at 53%, and in the most recent week, that's increased to 54%. So again, because these are cumulative numbers already, you're not going to see massive increases from week to week. It's a little bit more valuable when we start talking about now case rates per capita. So new cases in a given week adjusted for the population size in each county. And so the shading here is actually a recommendation from the CDC, something that they use in what's called their community profile report. And so I've just adopted that. So again, here you can clearly see that many, many more counties in the most recent week relative to the previous week are now shaded a deeper color. The more red we get in this case, the worse it is, the more cases per capita that we have in those counties. And so, again, if you hover over any county for either of the two tables, you get a lot of different information on a number of metrics. You get the number of new cases that week in the county, the cases per 100,000 population, where that county rank is. So in this particular week, Miami-Dade County was eighth highest in terms of cases per capita. It also gives you positivity, vaccination rates, both in the current week and then cumulative to date. And so again, as we go over here, it's the same kind of information, and you can see that Miami-Dade went from a rank of eighth worst in this case to ninth worst. So it hasn't changed much in position, but the level of new cases per capita has increased from 105 per 100,000 to 150 per 100,000. The next visualization is now the same kind of information, but it's positivity. So test positivity. We know recently, we've gone from around the 3% marker to 2 weeks ago, we went to just over 5%, and now we're almost at 8%. So positivity has been increasing, and you can even see that in these two county level maps. As we go from 2 weeks ago to just the most recent week, you can see a lot more counties are in the deep red, which is 15% or higher test positivity, and a lot more are also even in the orange, indicating that we're above 8%. And so again, the idea is to facilitate not only a where are we now by the map on the right, but also how does it compare to the week prior. Then for those people who like to get really granular with information, I've got a couple of tables. I won't belabor this. One of the nice things on these tables is you can restrict the comparison. So as I uncheck some of these boxes, let's say you only wanted to look at the 3 most recent weeks, you can filter down to that. Let's say you only wanted to look at a couple of different counties, you can also filter down to that. So I won't belabor it because, again, a table is pretty obvious in what it's showing. It's designed to show how we've been changing from week to week on these key metrics. Same thing here. It's another reflection of how are we changing over time. In this case, the focus is on demographics. So you can select from this drop-down box, a breakdown by age, by gender. You can just look at the overall numbers. You can stratify by race. And again, the idea is within each of those groups, how have we been changing over time? And again, you can dictate what weeks you want to compare. This is another, it's kind of similar information, but now in graphic form. In this case, what we're doing is we're comparing two metrics. On the top row, you're seeing weekly cases per capita, and on the bottom, it's case positivity. And so this is now looking over time for all ages together and then for each individual age group. And obviously, the take-home message with something like this is you can clearly see, regardless of what age group we're talking about, you see a pretty dramatic rise in the past couple of weeks in weekly cases per capita, and you also see a pretty dramatic rise in new case positivity in all age groups. But this also then facilitates a comparison, so you can see the age group that has the highest new cases per capita is the 30 to 39-year-old age group, followed closely by the 20 to 29-year-old age group. And thankfully, the lowest cases per capita that are being observed is in our elderly population. A big part of that is probably due to the heavy vaccination rates in the older age groups. And I would say it's the same story with new case positivity. The highest positivity is kind of in the younger working age group. Right now, also a little bit concerningly, high test positivity in the 12 to 19-year-olds. And then, of course, the lowest being as you get into those older, more vaccinated age groups. This one is, again, same information. People like the same information, just visualized in different ways. This is now not focusing on the absolute numbers, but more on the weekly change. So, for example, for new cases, if I focus on the only portion of our population that cannot be protected through vaccination, those children who are less than 12 years of age, you can see that 2 weeks ago, we had actually increased from the previous week 52%, in terms of the new cases per capita. And then even in the more recent week, even though we just had that big 52% increase, we had another 42% increase. So again, the interpretation of this bar is we increased 42% in the most recent week relative to the week right before that. And we had already increased 52% in this week relative to the one before. So this is really focused on change. And again, it's pretty easy to see that if you just look at the bars on the far right, that's the most recent week reported relative to the week before that. A lot of those numbers are not only positive, but they're really big. They're like 50% increases, which is a pretty pronounced increase. Same thing with positivity. And last but not least, let's say a little something about COVID-19 deaths. This gives, just like the cases curve, this gives the number of weekly deaths that have been reported to date. And then the red line is the cumulative number of deaths, or actually the deaths per capita. In this case, it says that in Florida, as of the most recent report, it's 174 people that have died from COVID-19 per 100,000 people in the population. And so this curve will always either increase or stay the same if there were no deaths, but it will never come down because it is a cumulative curve. And I would just caution people, as I always have, the numbers reported in these most recent weeks, they might be an underestimate of what we're actually seeing. Again, these are reported numbers, not deaths based on when they occurred. We no longer get that kind of information. So that's the end of this first page. I've got an attention here. This is just basically describing when I had to change my dashboard. You can access my old dashboard, even though the data are old. If you wanted to actually look at what that old dashboard looked like, you can see that here. And then down at the bottom, of course, my donate now has nothing to do with money. If you have questions or you just want to comment on something, you can just click on the email Jason button and it'll send an email to me. So that's that page. The next page is focused all on vaccinations, and this is not something that is specific to Florida. It certainly includes Florida, but this is also including all other states. So as we scroll down, the first one is state level vaccination rates. So what's cool about this is even though the default is to focus on the percentage of the entire population that has been fully vaccinated, first let's talk about that. So this is, state level information on the percentage of the entire population that's been fully vaccinated. And so you can see, for example, right now in Florida, that's 47%. The number in parentheses is the state rank. So the lower the number, so number one is obviously the best in this case. That would mean the highest vaccination rate. So Florida ranks kind of middle of the pack, 26th. If you hover over any state, you get a ton of information. You get information on the number of people fully vaccinated, have at least one dose in all different kind of breakdown scenarios. You get the percentages of all of those and the state rankings on those percentages. Again, this gives you kind of all of the information. But if you wanted to select a different metric, you could select it from this drop-down box. There are 8 different metrics you can choose from, and it would update the shading and the numbers for each state. You can also go back historically. This is always going to default to the most current date, but you can go back to any date that I have data for, or that at least the CDC or the Department of Health and Human Services making this data available. You can pick another date and it will update the information. So if you kind of wanted to compare, for example, where is Florida now in a national ranking relative to where they were in April or in February, if that's what you're interested in, you can access that information through this visualization. This is the exact same thing, but at the county level. So again, the shading in terms of vaccination rates, county level, in this case, red is bad, blue is good. The more red, the lower is the vaccination rates. The more blue, the higher is the vaccination rates. And so again, you can hover over any particular county. In this case, this is Hillsborough County, and you can get, again, that same very granular information on numbers of people vaccinated and percentages of the population that have been vaccinated. Another thing that's kind of cool, it might take a second to run because it'll probably reload this visualization, but if you wanted to drill down to a state, let's say I was interested in Florida, This will probably reload the visualization briefly, so bear with me just a second. But the idea is you can drill down to a state and it will only display the information for that state. So for example, here's Florida, and it drills down to Florida. Same information that it provides, but now you can also get a county ranking for that state. So you can see here in the tooltip, it says that Hillsborough County ranks 25th of the 67 counties that are in Florida. If you wanted to change this and look at California, again, it'll give you all of the counties just in California and the various rankings. So like over here, Marin County ranks number 1. They're best on this metric in terms of the highest vaccination rates. So that's the idea behind that. The next one is a state level comparison facilitator. So basically, this is kind of like the map, but we're looking over time now. The map is just a static image of where are we now. These lines obviously show us how have things changed over time. The default visualization just kind of randomly picks some of the larger states, some additional states to look at vaccination trends over time. But again, you can pick any vaccination measure. You can select any states. If you only want to look at one state, or if you want to compare 3 states, or if you want to compare them all, you can basically drill down to whatever level that you want. The next one is more of a projections. So again, the default, because I'm in Florida, is Florida, but you can pick any state in the country and do this, and you can pick any measure that you want to do this for. And the idea is the black line is showing you where have we come. So these are the vaccination rates for the measure that you have selected. And then what I've said is, if we follow the trends for the most recent 2 weeks, that's what this black line is. And so again, if you hover over it, it will tell you what percentage of the population are we estimating will have been vaccinated. You can see that red number going up over time. And then of course you get 2 important metrics. What's the date that we will hit 70% vaccination rate on this measure? What's the date that we would be estimated to hit 90%? Again, if we follow the exact same vaccination rate that we've had over the past 2 weeks. The green line is the kind of being optimistic. It's what if we doubled the rate of vaccinations over the past 2 weeks? Where would we be? And of course, the red is the more pessimistic. What if we halved the rate that we've observed over the past 2 weeks? So that's the idea behind this one. This is an interesting one. So these are state level projections. Again, you pick the measure of interest. Right now, it's the percentage of the population aged 18 years of age or older that have had at least 1 dose of the vaccine. This was the president's goal, 70% nationally. This shows you where each of the states are. So you can see the green states are already at 70%. And you can see that here, right? And this is when they hit the 70% marker. That's what all of this is about. The state is positioned along a timeline of when they are predicted to hit the 70% marker or when they've already hit it, right? So all of the states in green have already hit it. The state in yellow, North Carolina, is expected to hit it within the next 4 weeks. All of the states in the light orange are expected to hit it within the next 8 weeks, including Florida. And then all of the ones that are in red are expected to hit it at a much later time frame. And so you can see states like North Dakota, Idaho, Mississippi, they're not supposed to hit the 70% marker until next calendar year. So that's the idea behind this. Obviously, these things can change depending on how vaccination rates change. Here's something, this is the percentage of people who are only partially vaccinated. So one of the things I was concerned about is people coming for their first dose. Certainly if you've gotten Johnson & Johnson, you only need 1 dose and you're fully vaccinated. But for people who have gotten Pfizer or Moderna, you need the 2-dose series. And so what I was interested in is, let's focus on the percentage of all people vaccinated that are only partially vaccinated. Obviously, people who have been vaccinated more recently, they maybe have yet to get their 2nd dose. But relative to all people vaccinated, the numbers that have been vaccinated in the past 3 to 4 weeks is relatively small. So this, to me, is giving us a good idea of what percentage of people out there, maybe they didn't return for that 2nd dose. And of course, that's problematic because they're not fully protected, especially against variants like the Delta variant. And so what this will tell you is, in Florida, of all of those people 12 years of age or older, 14%, according to the CDC numbers, are only partially vaccinated. They're not fully vaccinated. And so you can see, for example, a state like Alabama. Alabama ranks 45th. That's not good. You want to rank high on this. In this case, it's saying almost 1 in every 5 people are only partially vaccinated. They have not returned to get that second dose if they took Pfizer or Moderna. Whereas a state up here, like, sorry, I accidentally lost that. You get the idea behind that visualization. There we go. Indiana ranks first in the country. Only 6% of people who have gotten at least one dose are only partially vaccinated, meaning 94% of people that have gotten at least one dose are already fully vaccinated. So that was the idea behind this. And of course, I presented at both the state level and then you can see the county level numbers on that as well. This is just a very basic graph. It's just showing you over time. This is the cumulative numbers over time. What share has been Johnson & Johnson, Moderna, Pfizer? So if you just hover over the most recent time point, you can see that right now in the United States, I believe this is all states right now, 53% of all people vaccinated have gotten Pfizer, 39% Moderna, 8% Johnson & Johnson. You can get the raw numbers of people vaccinated with each of those. So pretty straightforward visualization. These are some newer ones that I've added. So, a lot of people are trying to look at factors that may be associated with vaccination rates. And obviously, I don't think this does it justice. This is just trying to tie social vulnerability indices. So the higher the number, the more socially vulnerable a county in this case is. And there are a number of factors that go into what makes an area socially vulnerable. A lot of different metrics, and that's not the purpose of this video, but this is just trying to combine information. You can see there are 16 groups here. The more red a county is, that's the most risky, I would say, that county is. That indicates low vaccination rates and high social vulnerability index. That's kind of the deck is stacked against you. You don't have a good infrastructure for kind of dealing with COVID-19, and then you also have low vaccination rates. And then the bright blue is the lowest risk, I would say, because they have high vaccination rates. Over 50% of their population is fully vaccinated. And then they have a low social vulnerability index. So again, that's the idea behind this. Again, hovering over any particular county gives you a lot of information about that county. And then this is similar. Again, it's just trying to look at, broad level factors that I can easily access. This is basically a correlation plot on the left. And what it's showing you is basically, is there a correlation? Each of these circles on the graph is a county in the United States. The coloring of the county is the level of social vulnerability, and this is the actual index on a continuous scale. And then this is the vaccination rate on the Y scale. And what it's asking is, as we get more socially vulnerable, as we go from left to right, do we have a higher or lower vaccination rate in those counties? And the trend line here suggests that it's not a strong effect, to be honest with you. I think you can see the R square is only 6%, meaning that only 6% of the variation in vaccination rates at the county level are explained by this social vulnerability index. But there is a tendency for counties that are more socially vulnerable to have lower vaccination rates. Again, not a strong effect, but there's something there. What's cool about this is if you want to look at some outlier counties, you can focus on them. So like up here, this is a county that has a very high social vulnerability index, which is usually not a good thing. Yet their vaccination rate is really high, 75.9%. This is Santa Cruz County in Arizona. And so you can also look at, counties over here. These are counties with a very low social vulnerability index, but they have a very poor vaccination rate. So that's the idea behind this. And then on the right-hand side, this is very similar information. These are box plots showing the distribution of vaccination rates by county. And then I present that in the different social vulnerability classes. And so it's the same thing that you're seeing here, is there is a tendency that as we get to more socially vulnerable settings, counties in this case, you tend to have lower vaccination rates overall. And you tend to have, I don't know why this is, but you tend to have, less variability, but you have more outliers. So again, just interesting information. You can hover over the box plot and get various statistical information. So that was the idea on the vaccinations page. Let's talk quickly about another really important measure. These are hospitalization rates. So the first one is going to focus on people currently hospitalized with COVID 19. This is not new people coming into the hospital, but just who's in the hospital with COVID 19 on a given day. And so there's only 5 visualizations on this page. First, we'll talk about adult hospitalizations. So again, you can pick any state that you want. I've got Florida selected by the default. And so the blue bars are what they call confirmed. So when hospitals report this to the federal government or report it to the state, who then reports it to the federal government, they can classify a COVID 19 admission or hospitalization as confirmed or suspected. And there are very specific definitions about reporting each of those. And so the blue bars are the confirmed, the lighter blue bars at the top are suspected. And so you can see when we're talking about current people hospitalized with COVID 19, the overwhelming majority of them are what's classified as confirmed. And so, what we can see obviously here, the trends over time since last July, and unfortunately more recently, this is about the middle to end of June. Since then, we've been increasing pretty dramatically. This is just the most recent day in Florida. And so, again, I think this has to do a lot with the fact that there's still, many unvaccinated people in the state and the spread of the Delta variant, the relaxation of mitigation. We're starting to see an increase in severe illness. What I can tell you about these people who are being hospitalized with COVID 19, the overwhelming majority of them, the top thing they have in common is they are not protected through vaccination. And I think if you started to click on any state in this case, you'll probably find a similar thing. Missouri has been hit pretty heavily recently, so this will probably reload the map. Let me, because I've had these sitting here for a while, let me click on Missouri now. And yeah, you can see more recently what's been happening in Missouri, a pretty dramatic increase. Mississippi is another area that I believe has been starting to see an increase. And so again, you can look at any state of interest and see where their current hospitalizations are in adults. This is the same thing now in the pediatric population. So again, in Florida, unfortunately, just in the last couple of days, obviously this is not a consistent trend. There's a lot of up and down because pediatric hospitalizations are more rare. But we've seen this general tendency of late to start increasing. And again, you can pick any state to view that in. This is just a quick snapshot of where do states fall. So these are the state rankings on adult hospitalization rates per capita. So these are not numbers. These are adjusted for the population size in the state. And these are all adults. The one on the left only has confirmed cases. The one on the right includes both confirmed and suspected cases. And so in both of those cases, Florida now ranks fourth highest in the country as of July 10th. Here's the same thing for pediatric hospitalization rates per capita. Again, if we look at confirmed cases, Florida ranks, it looks fifth. And then if we focus here, Florida ranks 11th if we include both confirmed and suspected. And so here are the trends overall. I know this is a messy plot, but I like this, especially that I like to focus on Florida. I've chosen to color Florida in the deep blue line. Again, it just shows the trajectory of COVID-19 hospitalizations per capita in all states. And so again, it's population adjusted, and we can get a quick look. First, you can see some data anomalies, right? When a state shoots up and then back down, that's obviously an error in reporting. Not all of these errors get picked up, and so you see these anomalies. But you can see in that deep blue, Florida's uptick right here recently, and you can see the other states that have upticked very easily, right? This is Arkansas, this is Missouri, and this is Nevada. A lot of these other ones may have, they're maybe shadowed here, but now you can see that these rise to the top and why Florida ranks fourth now. So that's it for currently hospitalized. Then again, new hospital admissions is something that we're also interested in and that thankfully is provided and updated weekly by the Department of Health and Human Services. So again, the first visualization here is kind of like I showed you earlier with vaccinations. This is not focused on the number, it's the age distribution of new COVID admissions over time. And so again, one of the takeaways might be, well, since the beginning of the calendar year, and again, you can select any state you want, this is Florida, since the beginning of the calendar year, where people 70 years of age or older were making up almost half of new COVID-19 admissions, look at what vaccination has done, right? we can see that they make up only about a quarter now of new COVID-19 admissions. And of course, they continue to make up a quarter of new COVID-19 admissions because there are still plenty of people in this age group who have yet to receive a dose of a COVID-19 vaccine. Here is something that, when I look at this, it's a little bit more concerning. So these are new confirmed COVID-19 hospital admissions in the past 7 days. So each point that you hover over is actually an amalgamation of the most recent 7 days. So it's not just an anomaly that's one day. I kind of average it over time looking at the past 7 days. And so each of these lines is a different age group. Again, you can select any state that you want. This is Florida. And right now, the default is to look at the past 5 or 5.5 weeks. So going back to the beginning of June, what has the rate of new COVID-19 admissions look like? And unfortunately, you can see more recently, we're seeing pretty good increases in even older age groups. Again, there continue to be a lot of unvaccinated people, even in older age groups, but certainly in the younger age groups. And you can see that for all of these, we've seen a recent uptick in hospitalizations. That's why the number of people currently hospitalized with COVID-19 continues to go up. It's because we're also seeing new COVID-19 admissions in just about every age group, except maybe those individuals who are less than 20 years of age. And here are the state rankings again for people who want very detailed data in a table. This gives by age group, the per capita rate of new COVID-19 admissions in the most recent 7 days. And again, here are the rankings. Florida right now, if we just look at confirmed COVID-19 admissions in the past 7 days overall, they rank fourth highest. And then you can see they rank seventh highest in the 80 plus population, ninth highest in the 70 to 79, and so on. This is going to be now a repeat of exactly what we saw. The differences, and again, I don't have enough time to get into this very complicated mess of the variability in what's classified as confirmed versus suspected across facilities in the United States, but this is the same information now, not just looking at confirmed, but also including suspected. To be honest, although the rates are different, the message is the same. We're seeing increases in most age groups in Florida. And then that same table now focused on confirmed and suspected. Florida ranks 8th in this case if we combine both confirmed and suspected new COVID-19 admissions. This is just now showing you the level of variability in what is classified as confirmed versus suspected. And again, I could do a 3-hour talk on this, but I won't bore you with that. Let's just say that Florida tends to, relative to a lot of other states, almost 3 out of every 4 new admissions are classified as confirmed and not suspected, whereas some states like Maryland, Delaware, West Virginia, Pennsylvania, the overwhelming majority of new COVID-19 admissions are getting flagged as suspected. This does not mean that they're not true cases. I think a lot of this has to do with the timing. They might still be waiting on a test result to come back, and so when they submit their data, they're submitting it as suspected, whereas other facilities in these other states may wait to get the result back and then just report it as confirmed. So this is at least giving you information on that breakdown. Okay, the next one is on all-cause excess deaths. To be honest, this is not very different than what I used to report on my old dashboard. Again, I update this as soon as I get information every Wednesday from the CDC and the National Center for Health Statistics. Again, just a lot of information on the percent excess deaths, the number of excess deaths. I'd be cautious about interpreting the one on the left here. It is important to know volume of excess deaths, but obviously the bigger states are going to fall at the top here because this is on sheer number. If you have more people in your population, you're going to have more excess deaths. But the one that's on the right here shows you the percent excess deaths, which is kind of a way of adjusting for the population size. And I apologize that graphic has disappeared. It just reloads periodically to make sure that there haven't been any changes. This is an easy one. You pick your state of interest, and it's just going to show you how the percentage of excess deaths has changed over time. And so, this tends to mirror the epidemic curve. When you have a lot of cases, you have a lot of hospitalizations, you have a lot of deaths. And so this mirrors the epidemic curve, but it's cool because you can hover over any data point and get very granular information on the number of observed deaths, the number that we would have expected, and then the all-cause excess deaths and the percent excess deaths. Always be cautious about interpreting more recent data because all deaths have not yet been reported. This is to facilitate comparison, so it's the same kind of thing. It's looking at the excess deaths over time, but you can pick any states to compare. The default just shows you Florida, California, and the United States as a whole. Obviously, Florida had a pronounced summer surge. They also had a winter surge in cases, but less pronounced in terms of all-cause excess deaths. California had a less pronounced summer surge in last year, but a pretty dramatic surge in the winter, like the majority of the United States did. But again, you can select as many states as you want to include in this comparison. And then I think it's also important for some of these states to take into account that they might have underestimated their excess deaths because we have not gotten more recent reports on deaths. Like North Carolina is a perfect example. We have not gotten an observed count of COVID-19 deaths or even all-cause deaths from them in quite a while. So it becomes just for, yeah, I would say maybe the top four states there. I'd just be cautious about it. They might show lower excess deaths than they might actually have just because the reporting has not come in. That's it. The last one is, again, I did not create these visualizations, but I think it's important if somebody comes to my dashboard as a one-stop shop for important information. One of the most important things that we're tracking right now are the variants. So these are basically uploaded exactly what the CDC is presenting for the variants. So I won't belabor what these are because these are not my visualizations, but it's good information on the distribution of variants over time and how that's changing. Obviously, the take-home message with these is if you use their nowcasting option, which is basically forecasting and predicting, in the most recent week, the Delta variant is now making up 1 in every 2 cases in the United States. They then give that proportionately. So for some of the regions in the United States, the Delta variant is making up 3 in every 4 or 4 in every 5 new cases. In the region in which Florida is at, it's just over 1 in every 3. And then for some of the larger states for which they have enough cases to make estimates, they also give where we are in the most recent 4-week window. I can tell you almost assuredly this is for Florida, 13.2%. That's a gross underestimate because it does look at the past 4 weeks. So obviously 4 weeks ago, the Delta variant was not as prevalent as it is right now. And then even still, that 4-week period ended several weeks ago. So this is kind of dated information. I would say the prevalence in Florida is certainly much higher than that. How high, I don't know. Whether it's 30%, 40%, that's hard to gauge. But again, good information. So that's it. Oh my goodness, 42 minutes. I did not mean for it to go this long, but I'm hoping that for people who want to understand a visualization, you can just quickly navigate through this video, find the visualization that you're interested in. I do think a lot of the visualizations are pretty self-explanatory, but hopefully this helps to fill in the gaps. So as always, thank you for your attention. If you have any questions whatsoever, again, at the bottom of my my first page of my dashboard, you can email me and ask me any questions. So hope everybody's doing well, staying safe, happy, and healthy. Take care.